Hi everyone, so my name is Casey Pye, and together with Jess Andras and under the guidance of Dr. Gordon, we have created these mind maps and videos to try help make learning about contraception remotely a little bit easier and hopefully a bit more interesting. So without further ado, let's get started. So I have a question for you guys. What do condoms, the pill, bratty children, and social distancing due to the corona lockdown all have in common? That's right, they're all effective means of preventing pregnancy. So today, that is what we're going to be talking about, is contraception and just a basic intro to it. And before we get into the different methods, this video will first introduce the topic of contraception, why it's important, and a bit about the World Health Organization guidelines to delivering quality family planning services. So this has all been summarized in this mind map, and yeah, let's go through it. So the first question to consider is, why is contraception so important? And in this mind map, we've highlighted three main reasons, although there are probably tons more. So the first is that we have an overpopulation of people in South Africa and worldwide. And so contraception is really important to preventing unwanted pregnancies and also all the consequences that come with that, which may be worsening circumstances of poverty and also child abuse and child neglect. Then the next reason is that contraception is really important to providing women with empowerment, and not only so that they can take control of their own fertility and not just rely on their partner, but also so that they can plan their families. They can delay their pregnancies, or they may decide that they don't want to have any children at all. They can also plan their families around their career plans and any health concerns that they may have. And then the last reason that we've highlighted is that contraception is integral to the fight against HIV and AIDS, especially within the context of South Africa. Okay, and so because contraception is so important, we have come up with, well, the notes have suggested that the way to achieve all these goals is through providing quality family planning services. And this is really important for us as future medical professionals. So, according to our notes, to provide quality family planning services, there are three different things you need to take into consideration. The first is the medical eligibility criteria, which was developed by the World Health Organization, and we'll go into that a bit more just now. Then the next is that there are selected practice recommendations for contraceptive use that should be followed. And then lastly, it is really important to have an approach to HIV and contraception, especially within the South African context. So let's get into the first topic. So this is the medical eligibility criteria, and as I said before, it was developed by the World Health Organization. And what this is basically it's a categorization of different contraceptive methods and whether they are safe to use or not within the context of specific health conditions. So let me give you an example so it makes more sense. So let's say I'm a patient and I come in for family planning to my local practitioner, and I'm wanting to know if it's safe for me to use the pill because I'm worried that it might interact and maybe worsen my diabetes, for example, or maybe it might interact with my medication. So this is a helpful categorization to decide whether that method of contraception is safe or not to use within the context of diabetes, for example. So how it does this is it categorizes it as category 1, 2, 3, or 4. So in category 1, there's no restriction for the use of the contraceptive method within this health condition. Category 2, the advantages outweigh the risks. Category 3, the risks outweigh the advantages, so you should probably avoid this contraceptive. And then category 4 is that there's an unacceptable health risk of using this contraceptive within the context of this health condition. So an easy way for you to remember which one is which is in the silly little rhyme that I made up. So how it goes is category 1 or 2, this is the option for you. Category 3 or 4, better look for some more. So this is just a little rhyme to help you. So for example, I don't know about you, but I always get confused. I see that, I know the pill is category 1, and then I'm like, oh wait, is that a good thing or a bad thing? Which one is the good side and which is the bad side? So hopefully this will help you remember. So there's this really cool reference on the World Health Organization's website where they have this really cool wheel, and it shows you how you can use this wheel to decide whether a contraceptive is safe or not in different health conditions. So let's check it out. Okay, so this is the really cool wheel, and how it works is on the outer part of the wheel, it has all the different health conditions that may be of concern to you when suggesting contraceptive methods. And then on the inside of the circle, it has all these different contraceptive methods that you may be considering. So how it works is, so let's go with the case example I gave. Let's say your patient has diabetes and you want to know whether it's safe for them to use the pill. So according to this wheel, you look at diabetes and the pill, and over here it says that it is a category 2. So Remember the rhyme, category 1 or 2, this is the option for you. So you know that it is safe to use within the context of diabetes. So yeah, I just thought this wheel was really cool to reference, and it'll be listed in our reference list that you can refer to. And it has all sorts of conditions that you might want to consider. And I thought importantly to highlight, it also has one for medications and whether these things will interact with the medications like ARVs, TB medications, and anticonvulsants. So yeah, let's go back to the mind map. Okay, cool. So then the next thing we're going to be talking about is the selected practice recommendations that you should follow in contraceptive use. So let me give a quick case example. Let's say a woman comes in, she is 40 years old, she has 3 children, and she says that she has completed her family and does not want to have any more children. And she wants to know from you, which contraceptive should she choose? And now, before you answer, you don't give an answer because she is supposed to make the decision herself. All you do is provide all the options and the information that you have available, and then she should make the decision on her own. We should never choose a contraceptive method for our patients. So that means that these are part of the selected practice recommendations. The first is informed choice. So as I said, this means providing all the options that are available to the patient and providing information about their safety and how to use them effectively and just how effective they are in comparison to other methods. Then next you'd want to do a complete clinical assessment and screening. So this would involve taking a full medical history, family history, contraceptive history, and you would also want to do an STI HIV risk assessment because this could also not only inform your suggestions, but it could also form as a springboard for safe sex counseling and maybe recommendations for dual contraceptive use. Then you'd want to go on to a clinical assessment. You'd want to do a blood pressure check. If you're considering using a IUS or an IUD or female sterilization, you'd first want to do a pelvic exam. Then, although it's not essential, while you have this patient's trust and you're discussing these sensitive issues, it might also be a good idea to offer breast and cervical cancer screening, although like I said, it's not essential. And then also it's important to do a pap smear according to the national screening guidelines or when it's clinically indicated. And then the last thing is to have an approach to HIV and contraception. So this is quite an extensive topic, and so we'll cover it but more in a separate video. So yeah, thanks everyone.